yeast and found similar efficacy. And then if we look at research on at least histamine mediated conditions, the most data here has been published on seasonal allergy. So like conjunctive rhinosinusitis, runny nose, and just seasonal reactivity. Probiotics have been shown to measurably improve the histamine mediated allergy response.
Mm.
So I'm a big fan of probiotics because they can hit all three. And they also are helpful with leaky gut. There was a meta-analysis published in 2022 in Frontiers in Immunology, and they found that probiotics were effective in treating leaky gut. So a big, I think, really important foundational starting point, along with that gut type diet, would be the use of a probiotic.
What if aging isn't about slowing down, but leveling up? I'm Dr. Isaac Jones. This is the Longevity Leaders Podcast. Welcome to the Longevity Leaders Podcast. I'm Dr. Isaac Jones, and this episode is part of our exclusive series recorded at the Exponential Longevity Summit, a global gathering of cutting-edge health experts exploring the edge of human performance, health span, and longevity. Let's get into it. Welcome, Dr. Michael Ruscio. Thank you so much for being here today. I'm excited for us to get into this amazing topic of longevity, gut health. We're going to get into the microbiome. We're going to talk a little bit about just how all of these different elements will impact your longevity. So important, isn't it?
It really is. And as someone who wants to live a long time and also live well during those years, so, have a healthy anti-aging response, your gut is such a center point of the aging process, which, I guess we can unpack more if that's new to the viewers. But yeah, very excited to discuss that more.
That's so awesome. Well, tell us a little bit about yourself and how you got into this and what makes you tick. Like, clearly you've become one of the top experts in the space. I've reached out to ask who is out there that is, at the highest level in gut healing and health, and your name kept coming up, and I was like, all right, make an intro.
Nice. Well, thank you. Part of that is just due to my own painful experience, which I'm sure, many people in the health and medical world have a similar backstory. In college, I didn't know it, but I came down with an intestinal parasite
Mm.
and went from very healthy to insomnia, brain fog, depression. And I went through the standard channels of a conventional workup, and the doctors, I think, were doing their best, but nothing really flagged for them. All the tests looked normal. So I found my way, like so many of us, to integrative medicine, alternative medicine, and I kind of thought my doctor was crazy at first when he said, "I think you have a parasite," right? Because I hadn't been traveling, right? There was nothing in the history that was suggestive. Didn't go to Mexico, have food poisoning, and then all my signs and symptoms started. In fact,
Wow.
one thing that was really informative was I didn't have really any digestive symptoms. But we now know that it's possible, for example, with celiac, some celiac only manifests dermatologically, rheumatologically, neurologically, with no gastrointestinal symptoms. So it is possible to have silent celiac where it's only manifesting outside of the gut. Um, I mean, certainly if someone's having digestive symptoms, that's a big red flag, right? It's pretty obvious, but there can be such a thing in a time and a place where someone's only having brain fog and insomnia due to what's going on in their gut without any digestive symptoms. So I got myself healthier, thankfully, and it really motivated me to go into integrative healthcare. And one more thing I want to add, if I can, without going too long into the backstory, as I started learning in integrative medicine, sort of the patient-centered, longer visits, drilling into your history, understanding the individual, all of this was great. But there was some dogma attached. It did seem like some people had really strong views on whatever it was, toxins, diet, gluten. And I said, gosh, I think some of this is probably true, but some of it seems a bit extreme. And I had
Mm.
learned that earlier in my career when I was doing exercise physiology. There was a few people in this space that were sort of the really strong leaders who were super opinionated. And as a youngster, I sort of gravitated toward them. But over time, I realized you're not giving the full story. And that disturbs people when, we don't take a careful perspective on health, on gut health. We can shoehorn people into recommendations that they don't need. And so that's why we perform and publish research at the clinic to try to find that balance between what works when and not have this sort of everyone's got to be keto or whatever it is, but select the right tools for the right people.
Mm, yeah, it's like what we believe the future of longevity is going to be, and you align with this clearly, is more of like an N of one approach, which is like each person has a blueprint. Everybody has a different, um, way of needing to be healed and needing to be, optimized. And so, the fact that you've come to this as well is absolutely huge. And this is, for the listener, if you look at all the hallmarks of aging, one of the hallmarks of aging is a compromised and downregulated, microbiome. And so the gut is a key element of optimizing your health. Give us a few statistics about the gut and why the gut is so important.
Yeah.
I've as I've learned these over the years, it's like, oh my gosh, this is mind blowing.
Sure. Yeah. And it's easy to overlook. I'm sure experientially, a lot of people watching this have probably eaten something, felt bloated, like it didn't sit well with them, and say, oh, I feel kind of inflamed. I feel kind of
Yeah.
foggy. I feel kind of tired. Now, with the off chance, maybe it was like super spicy Mexican food or whatever. Okay. Every once in a while, something like that's going to happen. That doesn't necessarily mean anything is wrong or broken.
Hmm.
But that can be happening during most meals when the gut's dysfunctional. And of course, we absorb all of our nutrients, all the B vitamins and vitamin A, D, E, and K, the fat soluble vitamins, all of our amino acids, all of the anti inflammatory polyphenols through our gut. The, the delicate, truly delicate thing about the gut is we want to have maximal nutrient absorption, but without over absorbing toxins, bacterial fragments, and other particles that trigger the inflammatory response. So, this gatekeeping function is crucial for nutrient and caloric absorption. But since it's such a delicate membrane, it can get thrown out of balance pretty easily. And that's where we can have just chronic inflammation and nutrient malabsorption can sort of occur at the same time when the gut is dysfunctional. So it's a really crucial part of healthy physiology, if for no other reason than if the gut is not healthy, that can be spurring chronic inflammation due to the fact that that barrier is not working well in the gut. And on the other side of the barrier is your immune system. And the immune
Yeah.
system uses inflammation to clean up things it doesn't want in the system.
So would you say this is accurate if somebody has brain fog, if they have decreased energy, if they've got hormone dysregulation, if they have difficulty sleeping, if they're dealing with aches or pains in their back or their joints, all of that can actually be reconnected or connect back to a healthy gut or an unhealthy gut, right?
It can. The challenge is there's many things that those lists of symptoms can tie to. And I just
Yeah.
want to be careful. Coming back to my earlier point about there's the gluten guru, the vegan guru, the low carb. I just want to be careful to state that there's multiple things that can cause those symptoms. But if you look at this in terms of a prevalence hierarchy,
Hmm.
you have your basic diet and lifestyle. Don't eat garbage. Don't abuse your body with alcohol and cigarettes and not sleeping and not exercising. Second to that, I would say the most probable cause is someone's gut health. I'd put that before, let's say, Lyme or mold or mitochondrial dysfunction or hormone imbalances. Again, not to say it's all one or all the other, but I know healthcare consumers are confused because you can type in any symptom and get 17 different causes of said symptom, right?
Right.
So then what can really help is, well, what's the more likely cause of those symptoms and then second and third, and working through it in that sort of order of operations really helps us be more efficient.
Yeah, absolutely. So, what would you say the number one or what are some of the characteristics, maybe not the number one characteristic of the gut microbiota in people that are, say, 90 or older? Is there any kind of theme there on, people that have lived to over 90 in good health?
Some of the surveys here have found certain bacterial populations are higher in those who live to 100 or beyond, and also an increased diversity.
Yeah.
So diversity is how, how many plants you have growing in the garden. But there's, this is where things start to get, I think, specious very easily and very quickly, in the sense that if we observe that healthy people have a more diverse gut bacteria ecosystem, you
Hmm.
could then assume, well, then we just want to feed the gut bacteria, therefore people will be healthier. It's
Hmm.
not quite that simple. I'm not saying that a processed food diet devoid of fiber is healthy, but there's a little bit of a nuance here, in the sense that taking irritable bowel syndrome, IBS, which affects maybe 15-20% of the US population,
Hmm.
hallmarked by constipation, diarrhea, perhaps an oscillation between the two, abdominal pain, and bloating, right? So it's pretty common. It's been fairly conclusively demonstrated that using prebiotics, which feed the bacteria, have no beneficial impact on IBS. So
Hmm.
you would think, well, wait a minute, like if it's healthy to have really diverse bacteria and we give the treatment that makes the bacteria more diverse,
Right.
why don't people get healthier?
Right.
And that's because it's not quite so simple as just feeding the bacteria. I think more so the bacteria are a reflection of the ecosystem and the host health, not something you can just sort of push up. Another example would be if a man has a lot of estrogen because he's turning testosterone into estrogen, you wouldn't want to just say, well, let's give him more testosterone, because the problem is his milieu is inflammatory, right? So if you just try to force one number up in kind of a reductionistic fashion, you're not going to have the health outcome that you
Well,
want. And I just, yeah,
that's a great point. I remember I took a lab test. One of my doctors, he said, "Oh, you need to get on testosterone replacement therapy." And I was just like, "Okay, I'm not going to do that. I'm going to figure out what's causing it." And I was going
right.
through like a relatively stressful season of my life, and so newborn babies and traveling the world, speaking on
Oh, sure.
stages, and the litigation I was going through, and it was a little crazy, and so I just got really intentional about my sleep, got really intentional about my workouts, and a few other things, and boom, like my testosterone went well over 900. And so, and naturally, like I didn't do anything but just be more
Right.
intentional about that. But I love that you said that, and I love that the fact that your philosophy is more holistic, vitalistic, and you really understand the systems biology approach to everything, and that you can't just relate one symptom to one thing, right? Like if a breast cancer patient comes in, one breast cancer, one woman could have developed the breast cancer because she had genetic susceptibilities to mold exposure or whatever it might be, and the mold exposure triggered her breast cancer genes. Whereas the other person, it could have just been from eating so much vegetable oil and processed food, from all the phthalate or the phthalates and the glyphosate and all the other things that she's been exposed to, that triggered it. You know what I'm saying? So um, that's powerful. It's a powerful perspective. So you're saying though that people that live longer do have a healthier microbiome profile, correct?
Yes. Yes. But, again, the challenge is, how do we get people without a healthy microbiome to a healthier microbiome? But
Yeah.
yes, you're right. I don't know if I love looking at people who are really healthy and trying to reverse engineer what to do because of that, because a large component could be genetics. And you look at some people who treat their bodies in a very unhealthy way, and they are at a healthy weight, they look young, they have good skin, they have good hair. And then also there's obviously the cultural difference. A lot of these blue zones are not in the US, right? Their culture, down to everything from walking, more time with community, less adulterated food. It's really multifactorial. So the way I look at this, not to sort of spin off of your question too much, but what can we do in a population of people who might have some symptoms and some suffering? What's been shown to really help lift them out of that, make them more healthy, make them more resilient, and therefore make them, at least we think, live longer, or at least live feeling better.
Right, right. No, totally. That's awesome. So what dietary and supplement strategies really do you see can optimize the microbiota and help people live longer, healthier lives?
Well, I think the first step is doing a little bit of a self inventory, if you will, and trying to figure out what gut type they have. The gut typing, it's an older concept, technically in the research literature known as enterotyping. I'm not referring to that very sort of academic perspective, but rather clinically, what I've observed. So this is just my own heuristic. It's not published per se, but people tend toward a bacterial overgrowth type of gut, and I'll give some cues on each of these in a second. But bacterial overgrowth as the one type, fungal overgrowth as the other, and then histamine intolerant or what we call an immune type gut as the third. And this has direct ramifications for what you do with your diet and certain supplements. So that's why the framing matters. So in people with bacterial overgrowth or SIBO, that's very overlapping with IBS. So constipation, diarrhea, loose bowels, bloating. A couple hallmarks, excuse me, here are firstly, if someone's had a SIBO breath test and that's positive, that will tell you. But also, if they're noticing an aversion to vegetables. So they
Mm,
may notice, boy, broccoli, cauliflower, garlic, onions, asparagus, avocado. These are all very prebiotic rich foods that
yes.
feed bacteria. So if you have a pre-existing overgrowth, it makes sense those could be a trigger for you. And so that's the sort of diet you'd want to follow is reducing those vis-a-vis what's known as a low FODMAP diet or a low prebiotic diet. Now,
Right.
conversely, the fungal overgrowth types are kind of the inverse. They tend to thrive on like a lower carb, higher vegetable diet.
Yes.
But they may notice like, boy, I can't do rices, I can't do squashes, I can't do potatoes because fungus is fed by starches, sugars, and fruits.
Yep.
So this cohort will do well on lots of vegetables that are sort of lower glycemic, lower carb.
I
The
do the best
bacterial,
with that. Yeah.
yep, the
Personally.
bacterial, yep, myself also. The bacterial types, they actually will say, "Boy, I eat rice." I'll give you an example. For the breath test for SIBO, there's a preparation diet one day before, and that's essentially white rice and meat.
Hmm.
SIBO patients often say, "Holy smokes, I ate nothing but white rice and meat, and I felt fantastic." They don't do well on the vegetables. They do well on the starches and the sugars because the starches and the sugars don't feed bacteria.
Mm, no, that is incredible. So are those the three main like gut types, would you say?
Yeah, and the third being immune or histamine intolerant. And this is where people might notice fermented foods, especially fermented foods, jerkies, canned meats, canned fish, kombucha is another example of fermented food. If you notice an aversion to these foods, plus there might be a degree of environmental reactivity, you're allergic to dander or dust or pollen or maybe mold, that's more so the immune type, and they can go on a low histamine diet. And just the reason I lay that out is because instead of people being told, do this diet because it's the healthiest, you can take a stock of your symptoms and select a diet that's going to be the best as sort of a shorter term rehab plan for your gut. That's the way I look at all these diets. I'm not claiming these are the best diets in perpetuity, but
Right.
just like if you had a really fit friend and the fit friend sort of arrogantly said, "Well, just run 10 miles a day and weight lift 3 times per week." But you had an active injury. You couldn't do the plan, right? You need
Right.
a rehab plan to get you to that fit friend exercise
Exactly.
routine.
It's
So I look
so
at the
good.
diets as the same way. You
Right.
need a rehab diet so that you can then eat to whatever proclivities you have. Maybe you want to eat a certain way for whatever health reasons, but you don't have the food reactivity you're
You know what?
contending with limiting you from doing that.
That is such a brilliant way of looking at it because I mean, I just personally I remember, I was gluten intolerant. I couldn't stand gluten. I didn't eat gluten all the way until I went to Tuscany 2 years ago. And I
Mm.
went to Tuscany, and my friend Josh Axe, Dr. Axe, came to me and was like, dude, he's like, if you go to Italy, you better be eating some pasta. And I'm like, I don't eat pasta. I don't eat bread. I don't eat gluten. So I go
Right.
out there and I tried it, and it was like, I could eat it, no problem. And it didn't have any kind of I didn't have any reactions or anything like that. So, I don't recommend people like, go out and eat processed grain or anything, but I was eating like organic, from the ground in Tuscany, like,
Yeah.
heirloom
Yeah.
grains, and it didn't have any like reactivity. But the fact that you say rehab diet, like some people need to be on a rehab diet for, probably what, 6 months, some people maybe a year, other people, a few weeks. But there's kind of a customization of the rehab diet that needs to be
Yep.
integrated for somebody to get to a place where they're like, you know what, I can integrate this into my diet more, or that into my diet more. Is that right?
Yeah. Yes. And when you frame it as such, as a rehab diet, it's not the I'm on this, which is a huge problem, right? I'm on this diet forever. Um, and in the clinical setting, my heart breaks for maybe 30% of the people I work with. They've really been inculcated into thinking they've got to be on a given restrictive diet forever. And I get it, right? They're hearing this messaging, they're not feeling well, they're grasping for whatever straw of improvement they can. Like for the patients out there, I get it, I'm on your side 100%. But if we don't represent the diet the right way with the expectation that you're going to be able to improve food tolerance,
Mm,
people just drift into thinking that the more they restrict, the healthier they're going to be. And it's more so about just figuring out what restrictions you need. And gluten is actually a good case study for this. If we put aside highly adulterated gluten, right? Because I want to be careful never to make the baby with the bathwater argument. This happened with salt, it happened with fat, it happened with protein, right? We see these in processed foods, and people who don't like that macronutrient or that food thing will just vilify it in a guilt through association argument. So let's put away like the processed and adulterated gluten and think about something like you're saying, more of an ancient grain, even if it was wheat, rye, or barley, the gluten containing grains. One of the things that's really telling about the bacterial overgrowth types is that wheat, rye, and barley, your big gluten-containing grains, are also high in FODMAP, that prebiotic. And if people go gluten-free and they notice an improvement with their symptoms, it could be that they're actually improving their microbiota and their ability to metabolize those
yeah.
carbohydrates. And this has been shown in a meta-analysis that 50% of the FODMAP foods that were restricted can be reintroduced successfully. Again, rehab, you can get back to activity, including gluten. So I think for some people, they had a positive experience avoiding gluten, but they thought it was due to gluten and gliadin reactivity, the protein allergy that can be lifelong, where instead it was metabolism of the prebiotics, which is repairable.
Wow. Very, very interesting, powerful. And so, real quick, let's dive into each one before we get to solutions, because there are people out there like, how the heck can I tell if I've got this?
Right.
And what I would assume is, yeah, like you could do the breath test for SIBO, but like, what are some of the other symptoms of SIBO? What are some of the other symptoms of the fungal overgrowth? What are some of the other symptoms of histamine issues? And then why don't we dive into like solutions after that?
Sure, sure. Well, a few of the hallmarks of the fungal overgrowth type, like I think you and I have both noted, is if you go high carb, and maybe you can get away with a meal or two, but if
Mhm.
you're going too heavy with the rices and the starches, and even if it's gluten-free and organic and perfect, just too much carbohydrate tends to lead to some digestive symptoms. But one of the hallmarks, in my view, is there's usually associated fatigue and brain fog. So there
Mm,
might be bloating, there might be loose bowels. That's sort of common to all of these. But
yep.
I think the fatigue and the brain fog and the mood issues are more endemic in the fungal overgrowth population. Um, Now, someone may have noticed that they went or they had a prior use of antibiotics, so a history of high antibiotic use. And also if you had to use antibiotics for some whatever
That's
reason,
me.
and then you got worse, right?
Yeah.
That can be an indication. Things like a white tongue, rashing and fold, so the armpit fold, the groin fold, rashing, jock itch, athlete's foot, toenail fungus.
Mm-hmm.
recurrent vaginal yeast. And that's, anywhere between 5 and 20% of the population on some of those things, right? Now, with the bacterial overgrowth types, they may actually say, I went on an antibiotic and I felt better. And it's funny because in the clinic, you'll see this. People, they almost feel guilty saying it. Like, doc, I had a tooth pulled or whatever, and I had to go on amoxicillin, minocycline, whatever it was. And, I actually felt better out. It's like, okay, you're not guilty, right? That was actually doing something that you needed, which was reducing an overgrowth of bacteria. If someone's had food poisoning, traveler's diarrhea, and their symptoms started after that, that's more suggestive of a bacterial overgrowth type also.
Wow.
And then with the immune type, if there's a lot of just generalized supplement and environmental reactivity, if there's skin reactions like hives, urticaria, if there's palpitations, those can all be demonstrative of the histamine intolerant or the immune type. And there's definitely overlap, but the longer you listen to people, the more attuned you get at breaking these out. And I'm sure, hopefully anyway, as people are going through this, one of these resonates more with them than the other. And you can have more than one. There was a nice study by Satish Rao, who's a gastroenterologist at University of Augusta, and he surveyed people with GI symptoms for unbeknownst causes. And he found about 20% had SIBO, 20% had fungal overgrowth, and about 20% had both. So
Mm.
there can be both, right? But this is just a heuristic, again, to hopefully give people some direction on that first dietary step of low FODMAP, a candida diet or a low carb diet, or a low histamine diet.
Wow, that's so good. Thank you so much for that clarification. What are some of the best like therapeutic options for each gut type? Like what are the best things we can do with diet and with also maybe supplements or whatever else you want to talk about?
Sure, sure. Well, I'm a huge fan of probiotics, and full disclosure, we have made and developed our own probiotic product and a small line.
Nice.
That was an outgrowth of what I wanted as a clinician. So what worked, what helped people, what was there a fairly robust body of literature for, and then we designed a product to service that. Um, that disclosure aside, the wonderful thing about probiotics is they've been shown to be nearly as effective as antibiotics for SIBO. And there is an antibiotic known as rifaximin or Xifaxan that's FDA approved for SIBO, which I think is fine and okay, especially because it's localized in the gut. It's not absorbed, so it doesn't have a systemic effect. So the cool thing, though, is probiotics are similar in their efficacy, at least according to some meta-analyses. So it's pretty pinnacle level data in terms of I'm not cherry picking just one study. We're looking at summaries of multiple clinical trials. So it's a good aggregation of what the body of data is showing. So the probiotics will hit the bacterial overgrowth. They're also effective for candida. One study compared fluconazole to probiotics for vaginal yeast and found similar efficacy. And then if we look at research on at least histamine mediated conditions, the most data here has been published on seasonal allergy. So like conjunctive rhinosinusitis, runny nose, and just seasonal reactivity. Probiotics have been shown to measurably improve the histamine mediated allergy response.
Mm.
So I'm a big fan of probiotics because they can hit all three, and they also are helpful with leaky gut. There was a meta-analysis published in 2022 in Frontiers in Immunology, and they found that probiotics were effective in treating leaky gut. So a big, I think, really important foundational starting point, along with that gut type diet, would be the use of a probiotic.
I love it. I love it. So what do you what like is there anything specific that seems like the kind of like the best strategy for all gut types? What are like let's just get into like one particular gut type being the let's
Sure.
call it the fungal
Like, what do you
type.
do like beyond? Yeah, and
Yeah.
then certainly, and I can, tell you're a clinician because you're kind of thinking about this in a layered approach.
Yeah, yeah.
Which, taking a step back, is really the best way to do it because it's
Yeah.
tempting sometimes to just shotgun and give people a whole ton of stuff. And
Uh-huh.
that does work in some cases, but in more cases, I find something in that aggressive protocol triggers someone, and
Mm,
then you're trying to triage and pick up the pieces. So I
right.
do think if we're a little bit more methodical out of the gate, we actually cross the finish line much more quickly. It's so like tortoise or hare sort of debate. You think the tortoise is going to win or that the hare is going to win because they're moving really fast, but oftentimes they wander off track.
Yeah.
So the supplements for histamine intolerance, people have probably heard of these natural antihistamines. Vitamin C is one, quercetin is another, resveratrol is another. Um, Vitamin B6 actually and copper. There's a enzyme called DAO.
Hmm.
So all of these can be helpful for increasing the metabolism of histamine. For fungal overgrowth, I'm really starting to like garlic as one agent, oregano as another, and undecylenic acid as a third. And there's a herb from New Zealand called horopito. That's one that's also been shown to be pretty effective also. And then finally, for the bacterial overgrowth types, you can use oregano again. I also like garlic in that cohort. And there was recently a study looking at that rifaximin antibiotic compared to berberine. And what was cool about this study, knowing that bacterial overgrowth can sort of be trimmed down and then grow back over time, they did a 6-month follow up after the treatment ended. More people had prolongation of their SIBO being free in the berberine group as compared to the rifaximin antibiotic group. So there's
Wow.
really cool data being published showing us that the natural agents can be quite powerful. In fact, there was another study, this was in recurring vaginal yeast infections using that horopito herb, and it was better for preventing recurrence than was fluconazole. So I'm not saying the drugs don't have a time and a place, but it's just really exciting seeing how these relatively inexpensive, accessible, and many of these herbs also have secondary benefits
Yes.
are being shown to be similar or maybe even in some cases more effective than the pharmaceuticals. There is one small caveat, not to go too far into the scientific weeds, but when there's less research, there is something known as a positive publication bias, where usually the first couple of studies are the best because journals may not want to publish a negative finding. So I am a little bit bridled due to that, but nevertheless, to be totally fair and kind of put on my scientist hat for a second, but nevertheless, I think there's a growing body that at least justifies starting with naturals and then considering pharmaceuticals after that. And in a lot of cases, you don't ever need to do that, but just to kind of give the full case.
Now, one of the things you said was for SIBO, you use garlic, which earlier you said also was a prebiotic that's pretty high. So give us a kind of like logic behind that.
Yeah, when you use a garlic isolate, you don't seem to have the same problem as eating whole garlic.
Mm, right.
There's other ways of getting around that in terms of there's an isolate called alicillin, but we've tried it both ways and it doesn't really seem to be a trigger as does sort of whole garlic you would consume non-supplement form.
Yeah, that's great. And how is it that do you believe that our nutrition kind of protocol and our diet can really help us live a longer, healthier, more vibrant life?
Yeah. I'm glad you asked this because I recently had on the podcast Sarah Ballantyne, Dr. Sarah Ballantyne, who's
I
written a
like
few
her.
New York Times bestselling books in the
Yeah.
paleo space, but she's sort of had this recent renaissance in her mind, if you will, about nutrient density. She wrote a wonderful book called Nutrivore, thinking about, right, like carnivore versus, omnivore. How can we be nutrient focused? And what I loved about her book, outside of the fact that she gives you a top 100 most nutrient dense foods list, which I think is really helpful just to look at and try to eat progressively more and more of those foods as we get out of rehab phase and more into exercise phase, if you will. But one of the food groups or stuffs in there that was highly represented in that top 100 list was fish. And if you
Mm,
look at another paper by Boyd Eaton and Lauren Cordain, they surveyed all across the globe hunter gatherers looking at how do they eat. And you probably heard this whole thing about at the equator, it's kind of like they eat higher carb, lower protein. And at the poles, they eat lower carb, higher protein, this whole like metabolic typing concept.
mm. Yeah.
One of the things that Cordain and Eaton found was as you went more toward the north, so I'm Italian, so that'd be, Mediterranean, as you start moving from equatorial to Mediterranean, the main food stuff in the diet that changed was fish, increased fish consumption. So that perfectly overlaps with Ballantyne's posit. So there's a number of, I think herring, mackerel, and salmon were three of the best, but don't quote me on that. And those are all also low mercury. So I think one of the foods that we're not eating enough of, amongst a few others, might be fish in terms of, and this also ties in with another thing that we've recently been researching, which is people need to have more than 3 servings of fish per week. That from the American Heart Association of 2 to 3 servings of fatty fish per week is, it seems to be anyway, woefully inadequate to get inadequate omega 3. Now you can supplement, and I think it's good to supplement, but I think to your point, how can we eat our way into better nutrition? This
Yes.
is where 3, 4, maybe even 5 servings of fish per week, and none of those fish are high mercury, so that wouldn't be a concern.
That's great. I mean, and then you would just take a chelation agent if you you needed to every once in a while. I've
Yeah.
got a business in Japan, and every time I go to Tokyo, I'm eating sushi, and it's amazing. I always get the highest quality, but I always do a parasite cleanse when I come home. But yeah, and a mercury cleanse because I do like the fatty tuna when I go over there. But when you know how to chelate this stuff, it's good. So you stated at the beginning you don't necessarily want to recommend any particular type of diet. You have to customize it to each person. Is there a gut type diet for each gut type? What would you recommend there?
Oh yeah, I mean this is where kind of the way I look at this is we I think we personalize within a scientific framework, meaning we know that the low FODMAP diet is very well studied for bacterial overgrowth type guts. So that would be the one diet to use, and it's freely able to be looked up. You might see slightly conflicting things when you look this up. We have a version out there people can look into. I wouldn't get overly concerned about the small disagreement because the 80% core of all these diet handouts will align. So just don't let that perfect be the enemy of the good sort of throw you off of
Right, right.
just trying a low FODMAP diet. And then for the fungal overgrowth type, that's going to be the Candida diet. We also have a version of that, which is another way of saying that would be a low carb or a keto diet. I think people should probably try for keto and see how they do, making sure they get in adequate electrolytes and fat, because that can be a sticking point for some people. They're on a moderate carb diet at baseline. They
Yeah.
decide to go keto. They cut out the carbs. They don't replace with fat. And so
Mm-hmm.
they feel really hungry and tired. And then the third is a low histamine diet, again, which is freely available to be researched. The key component to any one of these diets is if it's the right diet for the individual, if it's the right rehab plan, they're going to know within 1 to 3 weeks. I'm not saying everything is going to be totally resolved, but they'll be saying, I have a little more energy. I'm a little less bloated. My bowels are better formed. So I just make that remark because I think we need to have a high expectation of like, are we giving good healthcare advice? And if we are, you're going to know it within a few weeks. Again, not saying everything is going to be totally resolved, but
Mm-hmm.
if you're on the diet for a few weeks and you're not feeling better or you're feeling worse, it's the wrong diet for you. Pivot to something else.
I love it. No, it's awesome. There's so much wisdom here. And so you said, low histamine diet for histamine, obviously, the candida, anti-candida kind of low carb diet for the fungal, and even the ketogenic diet. And then what did you say again for SIBO?
SIBO would be the low FODMAP diet.
The low FODMAP. Yeah. And so the question I always love to ask is, what are you doing personally for longevity right now? What are you integrating, maybe like experimenting with, in your lab at home?
Yeah, it's a loaded question. So I'm currently doing keto, and I have this theory I'm developing that the ability to get into ketosis is a proxy for someone's overall health. Because we do know that inflammation and infection can hinder mitochondrial function. And what mitochondria do, amongst other things, is they metabolize fat. So the keto diet, I have a sauna, which sadly just broke and is being repaired. So that's another big thing. Cold plunge. I have a red light panel. There was actually just a study published that found a 600-point reduction in TPO antibodies for Hashimoto's when using red light, which is remarkable. Vitamin D, selenium, those will give you about a 200-point reduction. So to see a 600-point reduction in a randomized control trial, so you have a sham placebo versus the actual light, 600 points is pretty substantial. So I'm doing total body red light. And I just started experimenting with, there's a mitochondrial peptide called MOT-C.
Mm-hmm.
And I did my first, it's a small pinch of belly fat injection. So I did my first injection of that today. It's too early to report, but I'm layering in a number of things for mitochondrial optimization because I'm curious to see how much juice we might get from a squeeze there therapeutically, so to speak.
Amazing. And do you feel like AI is going to change the game for healthcare moving forward?
I think it's interesting for video editing, right? I can say that for video editing for health research. Yes, I don't think we're quite there yet where it's going to be able to replace doctors in many capacities, at least in this realm, and maybe that's just my own bias. Although there is some interesting research on radiology and interpreting certain, radiographic and ultrasound and MRI findings via AI. So, I do think it's going to be an ongoing tool that's used. How much it's going to sort of replace integrated medicine, that's where I'm a little bit less clear. And I think it's because there's not quite the body of research. So if you have a ton of research, as in conventional medicine, I think AI can go through that and make decisions. When the body of literature is somewhat incomplete, and so some clinicians have to draw the best educated inference sort of beyond the data, that's where I'm not sure if AI is going to be able to make the best decisions because there's not the actual data to calculate. But, who knows? I'm not an AI expert, so take that with a grain of salt.
No, it's an exciting time for sure. And I know that a lot of people are moving towards, understanding how data and AI can help us make better decisions and create better outcomes. But man, thank you so much. This has been, Michael, such a great interview, Dr. Michael, and I appreciate you just sharing your wisdom and knowledge with us. You've got just an incredible breadth of education. I liked how, clinically this stuff works, and you also have a lot of confidence behind, how to get results with people because you've seen it yourself in your personal story, but also with the people that you're serving. At the same time, you're also looking at evidence and literature and science. So I respect that. Where can they find more information about you, or maybe if you've got a podcast, I think you shared earlier, love to hear a little bit more about how people could get access.
Yeah. Again, thank you. It's been thank you. It's been a great talk. I enjoy kind of sharing our back and forth on what's worked for us, because if we can help one person, I can say for me, the help I got changed my life. So if we can help one other person change their life, then huge win. drruscio.com, they can plug into the book, our store. We have a YouTube and a podcast. We have a virtual clinic. So if people are in need, they can always reach out. And we've published a few papers in peer-reviewed medical journals. So if you just search my name in PubMed, you'll see to date we have 3 papers in there and a 4th on the way, and hopefully many more beyond that.
I love it. Let's go. Thank you so much. Great job. I appreciate you, and definitely click the links below this interview to get more access to all the things that Dr. Michael's up to. Thanks so much.
Been a pleasure. Thank you.
Thanks for listening to the Longevity Leaders podcast. Our Longevity Leaders community is on mission to transform 100 million lives by 2040. If you enjoyed this show, please share this with somebody that you know, especially another doctor or physician, but also click that follow button. Until next time, stay strong and live long.